is to Facebook Live.
Everybody, first I'd like to introduce our home team, our DSA Los Angeles Healthcare Committee. The chairs are three people: Kenyon McFarland, Matt Reynolds, Sean Broadbent, and Cheng Sim is also, she's the fourth wheel there, who does a lot of work with the organizing for DSA Los Angeles Healthcare Committee. Matt, are you on?
Yeah, sure.
Hi, Matt. Matt, you want to give us a few words about DSA LA Healthcare Committee?
Sure. I'll drop right here when our next meeting is going to be. It's going to be on the 14th. Essentially, if you like to further discuss how we can get a single payer system here in California, and then also connecting that to the larger failures that capitalism has wrought on our city, our country, our world. Democratic Socialists of America, Los Angeles, is doing that for you, and it's a great place to get plugged in and add your shoulder to pushing against this horrible system. So I'm sure you guys will go much more into depth about how we can create a single payer system here. But if you want to continue that conversation, you didn't get enough here tonight, check out that link and join us on the 14th. So, and on behalf of the rest of the committee, thanks for having us here.
Thank you so much, Matt, for all your work, and Cheng Sim, you're on the call too, so thank you. We are so fortunate to have joining us from DSA San Francisco, our friends just up the road, Socrates Lee and Rob Romanelli, and they are the co-chairs of DSA San Francisco Healthcare Committee. They're sharing their single payer strategy presentation, which is why should single payer advocates do grassroots organizing? And they're going to share also insights from a post-presentation survey. They originally did this presentation a few weeks ago, and I was blown away. Several of us thought it was really fantastic, and it is. And it really spawned a lot of very interesting discussion. They had breakout rooms. It was really well done. So we thought it would be wonderful to have them come down the road here and talk to us in LA. So anyway, I just like to ask them to each, when they speak, Socrates, can you wave at everybody? And Rob Ravanelli, just give us maybe a sentence or two about what inspired you to start your quest and your long journey here on single payer universal healthcare, and then you can launch into your presentation. Thank you. Socrates?
Yeah, sure. Hi, my name is Socrates. I think for me, a big reason that I became interested in organizing around healthcare is because I realized it's like, besides all the reasons that it's very important and it will save lives, it's also a very strategic issue to organize around for the left, because it is a very deeply felt issue with wide dissatisfaction with our healthcare system, which is not to say that it's easy, just to say that there's a lot of potential there to organize around and to build a constituency for the left around. And I think a lot of the experiences that brought me to organize this, partly it was just graduating college and working and, you know, dealing with health insurance more and more. And part of it was volunteering as a crisis counselor for sexual assault survivors at the ER and also in a shelter, kind of seeing how much they were dealing with problems regarding the health insurance in very desperate situations. So that's kind of what brought me to this realization. And I'll, Rob, do you want to talk about you a little bit?
Sure. Hi, everyone. Rob Romanelli, DSA San Francisco Healthcare Committee co-chair. Yeah, I've been doing research in the healthcare space, particularly in disparities research for the last decade. And so the inequities in the healthcare system have always been at the forefront of my mind in my professional life. And what drove me to become more active in healthcare activism and becoming an advocate for single-payer healthcare was the COVID-19 pandemic. So this was very recently, seeing how the healthcare system has really failed us in this very dire time. So that's what got me more involved in this. So I'm happy to talk to you today. So Socrates, do you want to go ahead and start with?
Yeah, sure. So as Maureen said, this presentation was originally delivered at our open strategy meeting a couple of weeks ago. And sort of the intent of this meeting is to think about how we can do grassroots organizing around single payer, because there isn't an infrastructure to do this in California right now. And we want to think about how to build it. And the goal of that meeting wasn't to propose an already existing strategy, but to spur discussions in DSA chapters and also among other healthcare advocates that will lead to such a strategy being created. So Rob will talk a bit about the history of single payer in California and also results from that open strategy meeting. But the first part of the presentation that I'll give, which is just to talk about why we should even think about grassroots organizing at all. So as many of us know, the US has a healthcare system that's primarily motivated by profit. And that means that it's a system that requires inequality in access and outcome in order to exist. And thanks to decades of work by healthcare advocates, including on like the Bernie Sanders campaigns, we have a wider awareness of this system's dysfunction than possibly ever, and a wider acceptance of Medicare for all than ever. So we have a real opportunity to fight for a single payer healthcare system as part of a broad left movement. And we should kind of think about past strategies and why some worked and why some failed, so we don't waste this opportunity. So first of all, what does it mean to adopt a grassroots organizing strategy for single payer, and what doesn't it mean? Well, so a grassroots organizing strategy means we treat our ability to organize large numbers of people as our main weapon in the fight for single payer. But of course, the question has to be asked, like, why even do this? If other methods are more effective, we have to prioritize those instead. So to illustrate why we think the grassroots organizing is the approach we have to take to build a road to single payer, I want to bring up a sort of materialist premise for this discussion. And this premise is just the idea that people by and large do what they feel incentivized to do. So first of all, what does that mean for us as people interested in advocating for a single payer healthcare system? Well, it means that the healthcare system's problem is really the system and not the people who make it up and who those people are and their moral character. The system incentivizes people at the top to cause the suffering of people at the bottom because profits increase as they deny care to those who need it. So the moral character of the CEOs of insurance companies and the politicians that protect them should be irrelevant to us, because they're just acting how they're incentivized to act by our healthcare system, which requires inequality no matter who's at the top. And also because single payer is an existential threat to the health insurance industry, it's always worthwhile for them to pour more money into opposing single payer to the point where we can never realistically outspend them. But I wanted to take this idea and apply it further to how we've been fighting for single payer in the past. So if we accept that people generally act how they feel incentivized to act, that changes how we think about our legislators a lot. Because as activists, we're told that we should meet with our representatives to apply pressure, to change their minds, and even to appeal to them emotionally. And we spend a lot of time and effort dissecting what representatives and their staffers like and dislike, what talking points are closest to their hearts. And we are trying to discern between the good ones and the bad ones, the progressive ones and the ones that are bought out by corporations. But politicians are just people who face a variety of pressures, and the pressures that they obey are what they believe to be the most powerful ones. And when I say most powerful, I mean the most influential in keeping them in office and keeping their careers intact. So ultimately, that's what they're incentivized to obey. Whether they're good or bad people is, again, kind of irrelevant to whether they support us. We can't convince even the most kind-hearted people to support us if their career hinges on them opposing us. So in that sense, we can kind of understand our relationship with politicians very simply. We as single-payer supporters offer numerous incentives and threats, and so do our enemies, the health insurance industry. And if we want to get a politician to support a single payer system, we have to offer greater incentives and pose a greater threat than the health insurance industry. And as previously mentioned, for the health insurance industry, single payer is an existential threat, so they can spend all their money against it, and it'll be a worthwhile investment for them. So that is the first point that illustrates why grassroots organizing as an approach is really essential. Because we can always be outspent, we can only overcome the imbalance of wealth in favor of the health insurance industry with a greater imbalance of organized popular support in favor of single payer, creating a massive base that will vote for whoever supports single payer in spite of ads and media campaigns advising them not to vote for single payer. And such a base would have the power to swing representatives or simply replace the representatives who don't support us with ones who do. So to go back to the tactic of meeting with our representatives, meeting with our reps only applies as much pressure as they believe there are people behind us ready to vote them out. So it won't nearly be enough pressure if we don't build an organized grassroots movement capable of unseating them in spite of insurance industry spending. And meeting our legislators without building this grassroots movement over time only signals our weakness, because we've been asking politicians for single payer for many electoral cycles. They've ignored us, but they still sit in office over all this time. And let's take this materialist premise of people doing what they feel incentivized to do in another direction. So we talk a lot about different arguments for single payer, and people have pointed out in the past, rightly, that sometimes when we talk about single payer, we lean too heavily into wonkish policy arguments about spending numbers and which taxes will pay for single payer. But the remedy for this problem isn't to foreground a moral argument for single payer. Like, healthcare is a human right. That's something I strongly agree with. But morals are subjective. What if you talk to somebody with different morals? If we accept that people act how they feel incentivized to act, we should be appealing to their self-interest. How much money will I save with single payer? How much better will my healthcare be with single payer? How will single payer keep me from going bankrupt when I have a heart attack or develop cancer? How will it keep me from being a burden on my family? And we should help people see that it's in their own best interest to have a single payer healthcare system. This can be a true universal argument that can appeal to people across the political spectrum. And also the strongest argument if you want people to really commit firmly to single payer as something where they fight for themselves, to commit to it all the way to the ballot box, or even for people to become single payer advocates themselves. And let's not forget, this is exactly the front on which our enemies argue. They argue that single payer is bad for your self-interest. For decades, we've heard the same false claims against single payer, stoking fears of its costs, talking about rationed or poor quality healthcare, and raising the specter of increased taxation. So we should meet and directly counter these arguments rather than avoiding them by showing people that single payer is a way to save money, to increase your access to care, and to vastly improve your material conditions. It's the only choice that makes sense for your personal safety, your finances, or your family. And let's not be afraid to argue on this same front that our enemies do. And after all, when we talk about solidarity, we're not talking about charity that you do for other people because it's the right thing to do. Solidarity is recognizing that your self-interests are class interests. So we can't build a mass movement from imploring people to act out of concern for others. Rather, it can only be a movement of working class people fighting collectively for themselves. And all this is not to say we should never make a moral argument for single payer, just that we should recognize its limits. And let's apply this idea in one more area that we are familiar with as single payer advocates, which is protests and street action. And really what there is to be said about protests and street actions is similar to what I already said about meeting with our representatives. So protests about single payer do apply pressure on politicians, but can protests alone produce enough pressure? So behind a protest, there has to be a large enough popular base that will unseat politicians who disobey the will of that base, in spite of insurance industry spending. Otherwise, a politician is incentivized only to listen to the protesters, ignore the demands, and then vote against single payer, knowing that the protest wave poses a much smaller threat to their reelection than a pissed off insurance industry. And also we should think about to what extent do protests help us build our base? Are they good at convincing people who don't agree with or don't know about single payer that it's in their own best interest to have it? Or conversely, could these protests be alienating to people who stand to benefit from single payer, who we need in order to build our base, but are on the opposite side of cultural issues from us or see us as an extension of a Democratic Party that they dislike? And all this is to say that just like meeting with our reps, protests and street actions are just tactics, and they have benefits as well as costs. And over time, they can signal our weakness if we can't back up our words with consequences. And one more thought about incentives. If we accept that people generally act as they feel incentivized to act, we also have to ask ourselves, what incentives exist for people to do nothing about the current healthcare system, even if it is worse for them than single payer? Who stands to gain the most from single payer? And this is important when we are analyzing our potential allies and enemies, and to understand who is most likely to really commit to the fight for single payer. So to conclude on my section, we shouldn't really be shocked when politicians contradict themselves and when they go back on their word on single payer, when they adamantly oppose single payer in spite of COVID-19. None of this should really be shocking. If we correctly see ourselves as disorganized and unthreatening, while the insurance industry is wealthy and threatening, we can see that our politicians are just acting in line with their incentives. So the problem isn't that they don't understand single payer, it's that they understand it very well and they have every incentive to oppose it and none to support it. And a grassroots organizing strategy acknowledges and starts from this reality, and that's why it's our path forward. It accepts that we have to win on the back of mass pressure from below and not collaboration with wealthy people or corporations, and that we have to find ways to build this mass pressure while our opponents use their ever greater wealth to build counter pressure. So that's kind of the point of this presentation. Like, if somebody in San Francisco decided today, all of a sudden, that they want to spend their time and energy fighting for single payer, they would have no campaign for which to organize their neighbors and friends, and really nothing to talk to them about. It's far more likely that they would be directed to organize protests or meet with representatives about single payer. And so this problem perpetuates itself. That person should have a more useful way to spend their time and energy. And we have to break this self-sustaining loop. And that's what we wanted to bring people together to discuss in the open strategy meeting, was an infrastructure to direct people's time and energy toward convincing other people that single payer benefits them, to inoculating them against insurance industry messaging, and growing a single payer mass movement that the insurance industry doesn't have an immunity to. And so I'll pass it to Rob to talk a bit more about the history.
Great. Thanks, Socrates. So yeah, I'm going to talk a little bit about the history of single payer. I think many of you are already very well versed in this topic, but it does help to underscore the importance of using a material premise moving forward so that we don't repeat mistakes from the past. So in 1990 and 1992, single payer advocates tried to pass a bill for single payer healthcare, which was sponsored by then Democratic Senator Nick Petras. And these bills were for comprehensive medical coverage under which medical, dental, mental, and long-term health care would be covered for all Californians. But this bill didn't pass, in part because of, in the California state legislature, spending measures require 2/3 of supermajority to pass. And then in 1994, single payer advocates ran a ballot proposition for single payer healthcare. And as you already know, in California, if you get enough signatures, you can put a piece of legislation for a vote during an election and it can pass by simple majority. But this proposition, while it got on the ballot in 1994 as Prop 186, it failed with a 70% no vote. But the history of this campaign can really help us to understand which tactics work and which didn't, as this was arguably the closest California ever came to getting single payer healthcare. So the campaign did make mistakes. It treated the media narrative as the key to victory and spent vast resources on ads, but the media was always dominated by the opposition's messaging. Furthermore, the campaign gave itself very little time, only 6 months between getting on the ballot and the election, and it also overestimated its grassroots organization. It didn't reach nearly enough voters face-to-face because it was focused on ads, and organizers wrote off the idea of focusing on registering uninsured voters who stood to gain the most from single payer because they were disconnected from the political process. On its messaging, the campaign focused on a moral message about the insurance industry's greed, as opposed to a more materialist message appealing to people's self-interest, which is just what the opposition did by spreading fears about big taxes. Despite failing as a ballot measure, Prop 186 was a historic campaign in terms of grassroots organizing, as it trained 10,000 volunteers and gathered 1 million signatures in under 100 days. And it also raised $3.2 million from house parties and unions. The campaign also provided mass education on single payer and developed many single payer advocates who are still active to this day, a feat not matched by any California single payer campaigns that were to come after. And after Prop 186, there were single payer bills in California state legislature every few years, but they failed to pass and or were always amended so that they became declarations of intent to enact single payer or just became bills to create studies about healthcare. In 2003, 2006, and 2008, State Senator Sheila Kuhl introduced legislation to create a single-payer system in California. The first bill in 2003, SB 921, passed the Senate, but then later died in committee. And in 2006 and 2008, a new bill, SB 840, passed both houses, but was then vetoed each year by then Governor Arnold Schwarzenegger. And then in 2012, there was another single-payer bill in California State, the California Senate, SB 810, but it also failed to pass. Among those votes that killed the bill were 2 Democrats who voted against it and 4 Democrats who abstained. And in 2017, California state senators introduced another bill for single payer, SB 562. And it's worth noting that at the time, the governor was Democrat Jerry Brown, and the Democrats had supermajorities in both houses of the state legislature. So SB 562, I think as everyone is well aware, that it passed in the Senate but died in the Assembly, killed by Speaker Anthony Rendens, himself a Democrat. He refused to allow the Assembly to further amend the bill, essentially declaring that it was bad beyond rescuing. And then this brings us to today. Our Democratic Governor Gavin Newsom, who ran supporting single payer, has done nothing to bring it about since he's been in office. He's created a commission to gather information about healthcare reform, but as was mentioned earlier on this call, it has been on hiatus since September due to the COVID-19 pandemic. So if nothing else, this history teaches us the intelligence of our adversaries. And it's easy to look over the last 20 years and say that only if we had a Democratic governor in 2006 or 2008, maybe this wouldn't have happened. But Phil Angelides, the Democratic candidate for governor in 2006, didn't support the single payer bill anyway. We could also tell ourselves that if we only didn't have Rendon in 2018, but if Rendon really acted against the will of his party, we should ask ourselves why he's still the party-backed candidate for his seat, which he won. So why hasn't his own party turned on him if he blatantly disregarded its wishes? It's also worth noting that the governor in 2018, Democrat Jerry Brown, didn't support the single payer bill either. So if you look at the history of single payer, it should be clear that neither party is entirely willing to support it. Our Democratic leaders have let single payer pass in both houses of the legislature so that a Republican governor can veto it. And then once we had a Democratic governor in office, they killed single payer in the Assembly to save said Democratic governor the embarrassment of vetoing it. So the fact of the matter is politicians can oppose us, but we don't have an organizing base behind us. And if they support us, they will draw the wrath of the insurance industry without such a base to protect them. So I've yet to mention one of the most notable federal level healthcare reforms, the Affordable Care Act, which is hailed as massive progress, but the ACA is really just symbolic health reform designed to placate us. After a decade since it was enacted, the ACA has changed little for access to affordable health care, yet it has provided massive subsidies to private for-profit insurance companies. And the fact that the ACA subsidizes insurance industry profits with taxpayer money illustrates the contradiction of neoliberal healthcare reform. They attempt to improve our healthcare system through the insurance industry with profits by limiting the availability of care, which has made the system unequivocally worse. So put another way, improving access to affordable healthcare is in direct conflict with insurance industry profits. The ACA has also been useful for the health insurance industry's allies in their tactics of invoking a more immediate threat on the horizon that we should focus on or defend, which precludes all discussion of single payer reform. And unfortunately, having a Democrat in the Oval Office will not necessarily help us either, as President-elect Joe Biden's plan is to reinvest in the Affordable Care Act, essentially funneling more money into the for-profit insurance industry. And we could probably expect most Democratic US senators and representatives to back this plan. We must recognize that the ACA and Gavin Newsom's Healthcare Commission are tactics to distract and placate us. But in many ways, we are in a far more favorable environment for single payer than in the past. Bernie Sanders' 2016 and 2020 presidential campaigns have brought the idea of public goods and government spending back to the realm of political discussion. And the coronavirus pandemic has impressed upon people the ease with which they can lose employer-sponsored healthcare and the importance of strong public health infrastructure. So to be successful in single-payer healthcare reform, we can't rely on politicians to give us single payer. We can't continue to ask them for it. We must build a grassroots movement to demand it. And to achieve this, we need a long-term strategy with horizons beyond the next few election cycles in order to build this movement. So at our open strategy meeting, Socrates and I presented these sections of the political education part of the meeting. We had about 90 people that attended this meeting from various DSA chapters, including as well as healthcareforall and the community at large. And then we broke out into different groups to discuss strategic principles, and I'll present to you some of the highlights of that now. I'm also happy to share with you, for any of those that were not at the meeting and weren't on the email distribution list, our summary report. So from this meeting, we learned that our primary long-term strategy for single payer should be focused on building a constituency around the issue. Other strategic principles that were discussed, such as developing organizational capacity for our organizations or clarifying our opponents' contradictions, would really require the building of a strong constituency. So we saw this as being the necessary first step and the first principle. From these breakout groups, there were 4 political activities that emerged as tactics for building a constituency around single payer. One was writing a bill or proposition because it was felt that our constituents need something to organize around. Second was putting our politicians on notice and letting them know that we are a powerful force and will vote them out of office if they do not support single payer. Third was building coalitions with other organizations such as Black Lives Matter and the Poor People's Campaign to foster unity and diversity within our movement. And fourth, education through neighborhood outreach to grow our base and to inoculate the masses from the insurance industry's disinformation campaign. The path forward was recognized as having several challenges and opportunities. So while public support for single payer has never been stronger, we still must recognize that there are genuine fears as well as misconceptions about single payer that need to be clarified. While unions are among our most important allies, support from unions on single payer is not uniform, and we still have a lot of work to do to reach union leaders and members. And while we know that there's a statewide healthcare bill that's starting to be developed now, we do need to be realistic about whether we can get Governor Newsom to sign a bill if it were to pass in both houses of the legislature. But given the history of single payer in California, this is a big if. But still, it is important for something for us tangible to organize around. Another thing that came up was our arguments for single payer, which really need to be tailored to every audience more broadly. And we need to avoid academic liberal speak and instead speak to people about their own experiences as well as their material conditions. Furthermore, there was mention that our movement is in dire need of diversity from leadership and its constituents, and that it's important for us to work with organizations that represent diverse groups to build a more diverse base. Lastly, COVID-19 has presented a challenge with regard to political organizing. However, it also does represent an important opportunity for our single-payer movement, as the pandemic has underscored the importance of a system that is focused on public health, not corporate profits. And I'll end with stating that 75 years ago, history was at a crossroads. And in response to World War II, with hospital surges and mass deaths that countries in Europe experienced, these countries decided after the war that they would institute single-payer universal healthcare systems in their countries. And these systems have largely survived to this day, despite neoliberal policies, because of the widespread popular support. The US, however, took a different path after World War II, likely because Americans were not as directly exposed to the atrocities of the war, namely the human suffering and the death that happening on our own soil. And instead we adopted a for-profit health system. And what we have to show for it is higher costs and poorer outcomes. So while COVID-19 pales in comparison to World War II, I think COVID-19 does represent another crossroads, as it's the worst public health emergency that the US has seen in over a century. It's a war with a virus on our own soil. And in less than 1 year, more than 13 million Americans have been infected and 270,000 have lost their lives in this country. And this death toll is likely to approach 500,000 by early next year. And with 4% of the world's population, the US claims 20% of cases and deaths. This disproportionate burden of COVID-19 in the US is directly related to our poor public health infrastructure and a for-profit healthcare system that puts profits over people. So I see us as single-payer advocates really needing to make sure that the United States does not make the same mistake it made after World War II, and that in response to COVID-19, we really do take a step in the right direction towards stronger public health infrastructure and a single-payer system. Thank you.
Oh my gosh, you guys, that was amazing. I mean, I know you can't hear us, but so much round of applause. Thank you, both of you, so much. I want to go ahead and just hop in really quick and then open it up for question and answer, if that's okay with you guys. So just want to say briefly, it looks like the motion to sign on to the Sunrise petition has passed. So thank you, Isaac, for bringing that up. And for those of you who voted and are not yet members, if you could go ahead and please become members. Remember, it is what you can afford, not necessarily what is suggested on the forum. I'll drop that link. And Socrates and Rob, if anybody has a question, go ahead and raise your blue hand and I'll call on you. So it looks like Dr. Ron, you're up.
Thank you for your presentations. They're fantastic. And so in thinking about the distinction you were making between kind of materialist versus moral arguments, which is very thought-provoking to me. I wonder what you think about the fact that that Medicare for All polls very highly, and obviously people quibble about just how highly and how you ask the question, but what is missing, if you take it on its face value that those polls are sort of correct, what's missing in there as a mass movement? And is it something about the material versus moral argument, or what do you think?
Rob, do you mind if I go first? I could take it first. I think I think, I can't remember if maybe Rob touched on this briefly in his section, but from my view, and this is also from, well, so in my view, like with polls, I think in our chapter's healthcare committee, we've had like some discussion of the meaning of these polls as well, and that how you can change how people supposedly feel about something by changing wording of polls and stuff. But right, like, let's just say the polls are accurate, right? I think what's missing is that just at the end of the day, polls don't necessarily reflect how people will vote under different circumstances, right? So one simple example is like, you can say you can ask people about single payer, and you can even educate them about it. And maybe it polls very well, but that's just, that's happening kind of in the vacuum of, I'm just going to ask you this question about single payer. Anytime like a single payer, say it's on the ballot, like let's just say for like 94, it's on the ballot, right? The poll can't reflect how people will vote after they've undergone a massive campaign about single payer, how single payer is bad in the media. And it can't reflect also the fact that a lot more people will have heard, unless you have a really, really serious grassroots movement, a lot more people will have heard only that campaign and not your education piece about what single payer is and it's why it's good for your self-interest. So I would just say, yeah, I think polls are not necessarily like polls. I think the polls indicate to me what I mentioned earlier, like there's a lot of strategic potential in organizing for single payer, and that it's like a deeply felt issue for a lot of people, but also it's important to be sober about like where people are at about single payer in terms of probably a lot of people don't understand it, don't know what it is, and also could very easily be swayed by very simple messaging, oppositional messaging about like just spreading misinformation about single payer.
Yeah, I'd also, yeah, I totally agree. And I'd also just briefly mention that, you know, I think we've been relying upon the polls, or we've trusted the polls as being accurate, but I think as we've learned over the last 4 years, the polls maybe aren't as accurate. And I think, you know, that has something to do with bias and sampling. But I think there's also, as Socrates said, like saying that you would in theory vote for something may differ, or you're standing behind it, and then what you actually do at the ballot box once you have been inundated with the disinformation and propaganda that the insurance industry builds against it. So I think those are sometimes two different things. And I think certainly even within the given polls, in reading through the responses, I found a lot of redundancy where the majority of people are saying they support single payer healthcare, but the majority of the people are also saying that they want to keep their health insurance. So not fully understanding that single payer means that you can maybe keep your provider, but the insurer is going to be the government, not your current insurance. So I think there's both things going on.
Fantastic. I'm sorry, was there another hand?
Oh.
Socrates, that's you, go ahead.
Oh, okay, yeah. I was gonna briefly add to that, like, yeah, it's just very hard, I think. The question reminded me of something in my reading about like labor organizing, specifically like well-known labor organizer Jane McAlevey, about how it's difficult with polling to reflect how people will actually vote and behave in any kind of organizing setting. Like for example, it's easy to get a poll. Kind of easy to get a poll of workers to say they will support like a certain contract, for example, but that doesn't tell you as much about whether they'll actually support it when the pressure is on from their employer about, and it's much more accurate when you say, when you use something called like a structure test, which can be just like concrete commitments, such as, hey, if you support this contract that we're negotiating for, wear a button to work on this day. Like that's a concrete thing that they have to do that has some risk from their employer, right? So that just, again, illustrates how polling, again, takes place in kind of a vacuum where you're not facing the same pressures that you are when it's time to vote.
I'd also just briefly say that with regard to like voting out politicians that don't support single payer, at this point, I don't think we can assume that voters are single issue voters that are only voting on healthcare unless they feel very passionately about it. I think that voters are voting on all sorts of issues, and they may side with that politician either because they're familiar with them or because they like other things about them. So I think convincing people that they should vote this person out and vote someone else maybe that they don't know or are less familiar with on the basis of single payer healthcare may be a big leap for them. I don't know what the answer is for bridging that gap, but I think that's something that we need to work on.
Okay, so we have some more hands. Joel?
I think that what I'm hearing sounds hopelessly abstract and philosophical. There's a very specific situation we're faced with in COVID-19, which is giving us a world of arguments that people can actually relate to. I may not be able to get someone to listen to me talk about the rights of workers or how we all have to unite. That sounds relatively abstract. Preventing the person down the street who develops some symptoms from just ignoring them, making it easy, eliminating all the barriers to getting health care is something that the person I'm talking to can understand, because they see it as a threat to their own health. I don't hear many people who speak about healthcare, though, single-payer healthcare, talk about reducing barriers to getting treatment. And I think that we would get a lot more people coming to our meetings and getting involved if we took that approach, because that's what's on people's mind now.
Oh, sorry. Thanks, Joel. Okay, Rob, Socrates.
Oh, sorry, what was the question?
I think it was just a comment on
Oh, okay.
how we should utilize COVID as a way to motivate people.
Great. So as I move on to the next hand, it's Isaac. Isaac, if you have a question, would love, since we have Rob and Socrates here, to answer questions. So if you have a question, go ahead.
Yes, thank you. Yes, actually two quick questions. One is if either side, Rob, has any thoughts on how we might work to hold politicians like Rendon and Expedia to strengthen our end in the next fight. The second is something I just thought about. Health insurance companies are our major opponent. Drug companies are also allies of health insurance companies in this battle. Health insurance companies offer nothing of benefit. Drug companies on the margins do offer. Do you have any thoughts on whether or how we could divide and conquer those two massive opponents to help us win?
Thank you, Isaac.
Yeah, I'll let Socrates. Do you want to go first?
Yeah, sure. I guess I could go first. I don't have a lot of thoughts on the second question about like how to separate those different like sort of big industries to kind of help us. Like at the end of the day, I think what you see from these major corporations is like especially big industries, when we're talking about an existential threat to a whole industry of health insurance, right? I think in these fights, like you see a lot of, I guess, class solidarity from these big corporations in terms of recognizing that they share an interest, in a sense that they're weakened if single payer comes to be, even if, you know, it's just destroying the health insurance industry. It's going to weaken all the other sort of medical, like for example, the pharmaceutical industry. So on that front, I don't know how to drive a wedge there. I think I may be misremembering your first question, but I think it was about like kind of what can we do at this stage to hold politicians accountable, right? And I think the main point of that presentation is, again, like the whole idea of like holding politicians' feet to the fire is, I think, a little bit wishful thinking until you can have a really organized base that has a really strong position on things like single payer and is ready to kind of be ruthless about voting people out or just pressuring them with real backing in terms of numbers, because I think this is something even the DSA struggles with. Like, even if you help a politician get into office, which DSA does sometimes, it struggles with then controlling these people after they're in office, right? Because even if you fill their campaign staff with like DSA members, or in this scenario that we're talking about, like single payer advocates, it's hard to then control what they do and whose money they take and what interests they decide to obey once they're in office, right? So it really needs to be a lot of kind of essentially organizing your neighbors, organizing people down the street, and using your relationships to actually get a mass movement around single payer. That's my thought.
Yeah, I would just quickly add that I think between the insurance industry, pharmaceutical industry, pharmacy benefit managers, large hospital chains, the American Medical Association itself, there are a lot of giants with a lot of money and political cachet that are backing the politicians. And as I think the materialist premise and Socrates and I outlined, I think it's really about being able to pose a bigger threat to them than the insurance industry and those other industries all combined. And until we're able to do that by building the mass movement, I don't think we can win, because we'll never have the money that they have.
Wow, thank you. Okay, so I know we're at 8:30, but there are 2 more hands. Could you guys stick around to do 2 more questions and then we'll close it out? Sure. Okay, thank you. So next is Gina Harris.
Hey, so I mean, I totally I love what you guys are saying. It's kind of like exactly this on the same page as where I'm at with it right now. But you know, someone coming from the belly of the beast perspective when it comes to the payer sources, and which is it's a super convoluted and I still can't explain it. But when it comes to telling people that, like you said, oh, well, you don't have to worry about your insurance company because now it'll be the government. I think that shoots us in the foot, because we have spent the last 4 years seeing a failed government. We see what California is a failed Democratic supermajority. So how it's like, without saying that it's the government, because the minute we say it's the government, I can pull a right winger on single payer healthcare, but the minute I say government, that right winger is going to go. So it's like, what's the synonym for government that isn't quite the word government?
I don't know. Well, I think that's very true, and I think there is a lot of distrust, especially now with regard to our government. But I think there's a lot of things that we do trust the government to do, like currently Medicare. for the elderly. And there's probably other things as well. And I think we have to be able to build upon those things that we trust the government to do well in order to trust them with our healthcare. I know that may be an overly simplistic solution, but I totally agree that it is a barrier. I don't know how to address it though.
My take on this would just be that like you're rightly pointing out a big barrier, which is kind of how the government in general has been effectively like there's a lot of problems with government, but the concept of government itself has almost been demonized a bit kind of by in the last several decades of, I would say, neoliberal ideology. And from my experience talking to even just like conservatives in my family, it's hard because you need to have these types of conversations. You need to have established relationships and trust, right? But the conversation you can begin to have is, well, do you really think like we should trust corporations more than governments? Like, is it really better to trust, like, is your experience with Kaiser or Aetna tell you that it's nicer to trust them to be in charge of things? But yeah, I think you raise a good point about the problem with that. And that's kind of, I think, the reason the public education, that the sort of grassroots organizing and education is important, because the idea of government being bad is like deeply ingrained, and it's like simple to message through an ad or something like that. And to really change people's minds about something like that, you really need single payer advocates to actually be a presence in their lives and to have relationships with them, and to build, that's the way you build that mass movement and change people's minds, I think, to really get them to rethink who is kind of causing the problems in their lives, and kind of in some ways playing with the idea of like, well, do you really, right now it's managed by corporations, like, do you really think that's better? Because people who hate government, probably, I would bet a lot of them hate corporations too. At least that's my experience with my family members.
Thank you. I feel like those are the same people, Gina, who are out there with signs that say, "Get your government hands off my Social Security check." So there you go. Okay, last hand is Eric Pierce.
Oh wait, sorry, Erica. Robert Applebaum, I think, has had his hand up for a while.
I'm not even seeing that on my screen. So go, Mr. Applebaum, and then we'll head over to Eric Pierce.
Sorry, he's been waving his hand for about
I so
5 minutes.
appreciate you, Rob. Thank you.
Although you're on mute, Robert.
Can you unmute yourself, Robert?
I think does someone else need to unmute him?
I'm clicking the ask to unmute button. Robert, I'll keep clicking the ask to unmute button, but meanwhile, Eric Pierce, if you want to go ahead and ask your question.
Yeah, thanks. Thank you, guys. Thank you, Socrates and Rob. I need to study up on the materialist premise. So my question is this. I do believe single payer is the way to get mass people organized towards a socialist future. Talking about coalition, what have you come up with any strategies? Have you started to develop any strategies around coalition building, and then if so, what are they?
So we haven't done anything just yet. I could speak to some of the ideas that came out of our open strategy meeting, which was reaching out to and working with and working for other organizations, and building those partnerships and those trusts. So going out with Black Lives Matter and marching with them, working with the Poor People's Campaign, Even within DSA, working with other committees, right? So there are labor committees, tenant solidarity committees, homelessness committees, and we should be working in partnership with them and doing work for them so that they do work for us. So those were just some ideas that came out, but this is all relatively new information, and so hopefully we'll do something with it. But those were just some ideas that came out. Socrates, did you want to comment?
Yeah, I guess I have a more, it's not directly an answer to the question of coalition building, but it kind of can lead into that. So one thing I've been paying attention to, it's not even directly related to single payer, but it's something DSA LA has been working on as a chapter, which is their neighborhood solidarity program, which is simply the idea of just directly sending people who live in different neighborhoods of LA to go talk to their neighbors, try to get them to come to a neighborhood meeting where some direct services will be offered, such as helping with unemployment. But in terms of the agenda of that meeting is talking to people about what their issues are, kind of having an organizing conversation with them and doing some political education on those issues. Now, this is really broad. It can vary a lot depending on people's issues. And at this point, I think what they've run into is a lot of the issues people want to talk about are rent and rent cancellation, and navigating unemployment, the unemployment system. But these kind of have become opportunities to talk about public goods. And that's a real way to, and in a sense, this is a sort of coalition building, or you could call it recruitment almost, of just recruiting people who are not connected to any kind of political org or even consider themselves to be very political at all, and kind of using this kind of pipeline of come to a neighborhood meeting and then where you do some political education and then you try to get some people then plugged into political campaigns that are relevant to their issues, or even to start political campaigns relevant to their issues. And this is a way of, again, reaching people who aren't activists, maybe don't even care about any kind of political stuff. Like they just don't see politics as part of their life even. So I guess that's kind of not really a direct answer to the question, but it's something relevant to growing our orgs and growing our coalition.
Okay.
Yes, Robert, Mr. Applebaum, go for it.
Yes, I'm in San Jose, originally from New York. I was with the American Museum of Natural History. I was in charge of benefits there. I took some of the insurance private at that point. Came out here to California in like '98. Got very involved in single payer with Healthcareforall California as well. But times have changed. With the COVID-19, we're losing so many people. People aren't keeping their jobs. They don't have security to know that they can go to any doctor, any hospital they want. The insurance industry and the pharmaceutical industry is making tons of money, not like they're doing in other countries, but here. And so they're convincing people to stay out of it. We can't just focus on California. We have to focus on the national bill. HR 1384, Pramila Jayapal from the state of Washington, for a year now has 118 co-sponsors. I was on for the Board of Supervisors in Santa Clara County. I was on the going for 14 years there. They endorsed 1384 in more than a year ago. San Francisco Board of Supervisors did it immediately. Los Angeles is in support of it. There are 118 co-sponsors. The insurance industry is making tons of money. The pharmaceutical industry is making tons of money. They don't give a damn about what happens to anybody else. People have to be aware that Taiwan, 25 years ago, they thought America's healthcare for all, the plan that we had and the Canadian plan must be the best in the world. They were taught and realized it wasn't. And within 1 year, they put together a bill that covered everybody in the country, less than half the cost of the other countries. And everybody got an ID card. They can go to any doctor they want, any hospital they want, put it in the computer there, put in their security code. Doctor puts in his, their whole medical history comes up on the board, and the doctor is paid automatically.
Thank you, Robert, so much. Do you have a question?
No, there's more to that. I mean, at the beginning of this century, around the beginning of this year, they tested all of their people. Those that were sick with it, they separated. They kept their businesses going. Everybody had their mask. Everything was going. They have the best solution in the whole world. They have the lowest cost and the best care. And it's disgusting what goes on here because everybody's making a lot of money, and the only thing that trickles down is the sewage. So,
okay, so Robert, I'm gonna thank you so much for pointing that out, and couldn't agree with you more. We are over time, so we do have to end this meeting. But thank you so much, Socrates and Rob, for coming on here tonight and giving us your presentations. Thank you, everyone, for your great questions and comments.
Can you unmute everyone so we can all say goodbye?